Hello, everyone. Welcome to the webinar today, Bridging Pre-Bill and Retrospective Audits. We are going to get started in just about a minute or two and waiting on a few more attendees to go ahead and come into the meeting. So in just about a minute or two, we're excited to get started with our conversation today, and thank you for being here. All right, well, we've seen the users climb here, so we're going to go ahead and get started on our webinar with Cooper University Healthcare. Welcome, everyone. My name is Charlie Thompson. I'm excited to host this conversation today with Maureen Trainor and Ashley Nanan from Cooper University Healthcare, along with my colleague, Ashley Lodato. And today we're going to be discussing the bridging pre-bill and retrospective audits. So just a quick introduction on our folks that are on the call for everyone. As I mentioned, my name is Charlie Thompson. I am the sales engineer here with Streamline Health, and I'll be hosting the meeting today. And I'm excited for you all to have an interactive experience and learn from Maureen Trainor, who is the Director of HIM at Cooper University Healthcare, along with Ashley Nanan, who is the Manager of Inpatient Coding at Cooper University Healthcare. And just to give you some bios on these folks real quick, Maureen Trainor is currently the Director of Health Information Management at Cooper University Healthcare in Camden, New Jersey. She's worked in other large healthcare facilities in New York, New Jersey, and Pennsylvania, including Pocono Medical Center, St. Vincent's Hospital, NYC, and St. Clair's Health Systems in Denville, New Jersey, while spending 13 years in Florida at Broward Health. She's been actively involved in New Jersey HEMA as a member and board member over the years. Ashley Nanan. Ashley is a dedicated HIM professional with 15 years of experience. For the past 4+ years, Ashley has served as the inpatient coding manager at Cooper University Healthcare, where she oversees a dynamic team of over 18 associates, including coders and auditors. Her certifications include strategic leadership, RHIA, CCS, and CPC. She is also the education chair for the Southeastern Pennsylvania HEMA chapter, as well, and recently graduated from the CUNY SPS HIM program and Rutgers University's MBA program. Her strengths lie in strategy, team collaboration, technology, education, and leading through change, which you will hear about today. And then, Ashley, I will let you introduce yourself for the folks as we get started with our roundtable discussion coming up. Ashley,
sure. Thanks, Charlie. Yes, we have two Ashleys on here, so trying to keep us separate. I'm the vice president of the Eastern region at Streamline Health and have been here for over 9 years, and a critical contributor to our growth team, and have worked very closely with the Cooper team specifically. So look forward to contributing to the conversation and letting them mainly share their story and success.
Thank you. All right, just a little bit of the agenda today and then some housekeeping items. So again, this is an interactive webinar experience. You all have access to the chat and the Q&A. So I want to point first to the top of your web browser or your Teams browser. You'll see the Q&A function. So as we go through this discussion with Maureen and Ashley, then you can insert those questions into the Q&A prompt, and then we will answer those at the end of the presentation. Also, while we are in the midst of our discussion, you can participate in the chat box. And that is we have a mix of folks on the call. So we have folks that are just getting introduced to Streamline or Cooper University Healthcare. We have folks that are familiar, and then we also have current clients on the call as well. So you're encouraged to chime in and participate in this conversation. And what we're going to be talking about today is bridging that gap and really talking about how pre-bill and retrospective audits work together. We're going to talk about Cooper University's experience and how we optimize those post-bill findings and move that up in the workflow. Lessons learned on how to fine-tune our coding workflows, maximizing opportunities, and then expanding that pre-bill validation into outpatient coding. And then, of course, we'll have a Q&A at the end there. Before we get started into the conversation, though, I wanted to make this a fun and interactive experience. So I'm going to start you off with a fun riddle. So riddle me this, and you can put your answers in the chat. One checks your work before it flies, the other peeks with hindsight eyes. One shouts, wait, before you send, the other fixes what you didn't intend. One is a guardrail, the other a mop. Together we keep the errors from the top. So I'll give you about a minute to answer that. And this one I'm going to give you the answer for, and we're going to mix some of these riddles throughout the webinar experience for you today. Any guesses coming in the chat on what are we? I'll give you a hint. It was on the beginning slide. And it might have to do with something that we're talking about today. One happens before, one happens after. I see a lot of guesses of AI. I like that. I like that guess. There's a guess for audit there. And that is correct. It is pre-bill and retrospective audits. That's what they are together. Pre-bill and retrospective audits. All righty. So I'm going to pause sharing my screen now, and we are going to dive into the discussion. So give me 1 second to do that. And then, Jack, if you wouldn't mind, go ahead and spotlight the four of us. I think that would be helpful. And then we will get this going. All right, so to kick this off, Cooper University Healthcare, they first implemented Streamline Health's eValuator to strengthen their pre-bill coding validation, trying to ensure accuracy before claims were submitted. However, retrospective audits later identified additional opportunities, revenue opportunities, revealing gaps in workflows and bandwidth challenges and areas where coding rules could be refined. Instead of viewing this as a setback, Cooper saw it as an opportunity to fine-tune their pre-bill approach. Today, Maureen and Ashley are going to share their experience and successes in leveraging insights from both pre-bill and retrospective audits to drive better accuracy, compliance, and financial outcomes. So to set the stage, I wanted to first, I wanted to first bring on Ashley Lodato and kind of discuss, kind of how Cooper University got started with Streamline Health and where they were, and kind of set the stage for Maureen and Ashley to jump in.
Yeah, sure. So what you'll hear is, Maureen actually came in after they had implemented the technology. So I had worked with the previous director, and at the time they were outsourcing their reviews to a third-party audit firm, which isn't any different than, what a lot of organizations are doing today. Their coders were receiving about 95% accuracy rates, right, which is the standard within the industry that organizations look for. But what they were experiencing was the billing team was coming back with missed opportunities, and their internal audits were uncovering more educational opportunities. So the director at the time really said, okay, we're doing these third-party audits, but we're still missing stuff. And that's really because they were only looking at like a very small percentage of the population. And so when I had talked to them at the time about the idea of adding technology to the process, the director had really picked up on the value of that and saw the opportunity to really have Cooper take ownership of their quality by leveraging their existing resources and start gaining visibility into their gaps through data. And so that's not to say that there isn't still a place for third-party audits, because obviously we're going to talk about that today, but a big part of that was really leveraging technology now to help them transform their operations internally, take a new approach to auditing, and ultimately identify errors upstream and build some more meaningful education plans to drive that accuracy across the organization. And so obviously Maureen and Ashley are going to elaborate a lot more on that today.
Yeah, when you talk about leveraging technology, I think that's an important point. So Maureen, I kind of want you to give me your experience prior to Cooper, and then when you started at Cooper, what got you most excited when you learned about eValuator being able to leverage technology? So just kind of walk me through your experience there.
I felt blessed. I'm going to tell you that because where I came from, we did not have a formal QA process in place for coding. We had quarterly audits of the coders being done by corporate compliance, but then, conflicting priorities took place and audits were always delayed. So when I got here to learn that we had 3 FTEs dedicated to coding auditing, with the use of the pre-bill technology, I was like, wow, this is really something else. It's amazing. And so I had never used a pre-bill technology like we have with Streamline. So I had to quickly get up to speed, and thanks to Ashley for providing, the hands-on approach to this. And I found it very easy to use, to look at the dashboards, to look at the productivity, to see the opportunities and the rewards that came from it. So it was a major shift for me to have this already built in into my department. And we have grown leaps and bounds. And I've been 4 years. My anniversary is next week. So they had just gone live with this right before I started.
Well, congratulations on your anniversary.
Thanks.
And you mentioned something there, with Ashley Nanan's experience, and already kind of having this technology in place. So I kind of want to, with the excitement of that, Maureen, when you coming on board, and then Ashley being there and kind of helping you that. So Ashley, kind of walk me through some of the early findings and the role of kind of what retrospective audits were playing. And then where were you finding some additional opportunities, and what were the key takeaways for those
Yeah,
findings?
yeah, sure. Similar to Maureen, when I got there at Cooper as well, Streamline, you guys were there in the initial phase. So I was kind of blessed as well to kind of guide it from the beginning. So kind of, tailor the process and any improvements that we had along the way. It was done, at that time. But in regards to, or they really didn't had a quality plan. We didn't have a quality program per se. It was just like retro audits on focus DRGs that was being reviewed. And it was a more manual process. So bringing the technology along and refining the process was indeed a blessing for the quality team, which they had liked. I mean, it was a learning phase as well, but I think we got through that and learning from our that pre-build process, we were able to tailor our retrospective process and improving our overall quality plan and
What
program.
and what types of things were not originally flagging for you? Things like strokes and
Yes.
NTAPs that you were able to then move up in the process?
Yeah, so learning from pre-bill, what we were doing pre-bill, we still saw some opportunity there that we're still lying for NTAPs especially. That was one of our biggest findings where we created rules instantly where we saw retrospectively we were having some changes for that. So we had that added. So we had a lot of for strokes, the NTAP, sepsis, POAs, we have all of those cases are being flagged as well for sepsis. So those are being reviewed for 100% now in our pre-bill because of retro audits done.
Yeah, and then kind of combining those retro audits, moving them up to pre-bill, Maureen, how did you, ensure that those retrospective audits weren't seen as a failure and you kind of saw them as an opportunity of like, hey, we can do something great with this? How did you look at that?
First, I want to give credit to Ashley Nanan here because we have a very, let's say, elaborate QA plan, a document that was vetted through our human resources department. She came to me with it, and I said, wow, this is a lot of information. It has screenshots, tools, and the rules of the road of what we're going to follow. And if an employee doesn't meet 95% accuracy, what's going to happen? So this was rolled out to the entire team. So we leveled the playing field, number one. It sort of came a little after. Obviously, this was in place, Streamline was in place, but then we had some findings that we needed to address. And I said, well, we need to let the employees know what's coming down the pike. So that was great. So first of all, we do not look at this program as punitive. It's educational. And actually, just recently, I went to HR and I asked to change the title because we had 3 coding quality specialists on the inpatient side. And we recently changed their title to coding quality reviewer and educator because their role has grown so much since the implementation of this also. So the coders actually look to the coding quality reviewers as their mentors. They have a direct lifeline to them. They have a question, they place the chart on hold, and even when the charts are flagged in Streamline, the quality reviewer is auditing that chart and deciding whether or not that's going to be sent back to the coder. So, I don't see even the retrospective audits because the quality reviewers are getting involved in that as well. When the audits come back, somebody's got to audit them right here to decide whether we're going to have a rebuttal or we're going to accept it. So there too, it's a lot of collaboration. And I believe me, when I first got here, it was a total mind shift to say that this is to promote growth and education and not to be punitive. So it's fabulous, actually.
Yeah. And with those changes that, you were kind of making not only to, the titles, but also to, the system itself, the rules and the workflows, what kind of changes did that help you find, Ashley, as you were, you created this document, you guys were, doing education, you were making these findings. So what kind of changes what kind of changes were you able to find?
Yeah, so definitely the number of charts we audited that had increased, but also like I mentioned before, it was more about consistency. So we started the retro process to create consistency in the amount of audits we were doing per coder, because in the pre-bill process we were, one coder may have 20 accounts, their DRG accuracy might not be 95% for that month. If, versus another coder, they might have 40 accounts audited. So really that was the big push for our retro audits because we wanted consistency for the teams. So as of right now, the team is having 20 accounts for everyone retrospectively audited. So we saw that shift as well, where the coders too, they feel valued, where they're trusting the findings more, because in the pre-bill setting, it's more likely a change that's going to result in these audits. So having accounts that is not flagged, and we also see opportunities too, like maybe we should turn a different rule on based on accounts not being flagged initially. So especially, like I said, for the NTA, CVAs was our big one because we had a lot of CVA spinal fusions. We saw some changes with spinal fusion. So we created rules for those as well.
Yeah, absolutely.
And
And
on the
then Ashley,
outpatient side too, it's the same. We didn't have inpatient. I might be going ahead, but I can't help it. On the outpatient side, it's the same thing. When they see errors coming back in claim edits, they're reaching out to your team to build rules, say for the shoulder procedures with debridements or cystoscopes with a hysterectomy, like things that should be combined, like automatically flagging so that the quality specialists are reviewing them pre-bill. So they're reducing the risk.
yeah, absolutely. And then Ashley Lodato, I know in this conversation there was, a consultative services engagement that kind of, assisted you. So Ashley Lodato, if you could, help walk through that and what that was like for Maureen and Ashley and what that led to for them.
Yeah, I see Maureen giggling because this was something that she had called me about. It was actually, I was looking at the date. It was back in 2023 now. So our client success team reports out every month what the Cooper team is doing, right? So how many cases are being analyzed, flagged, reviewed? What are the results of that from either DRG change rate or quality change? And so when Maureen was looking at that month over month, right, and especially on the inpatient side, Maureen and Ashley were saying, okay, we're doing a pretty good job, but there's hundreds of encounters that are flagging within the tool that our team is actually not auditing or getting to because they didn't have the bandwidth. But they recognize that there's probably some extra money in there, probably some opportunities that they could be capitalizing on that they just weren't getting to. So Maureen and I had a conversation around our team actually doing that auditing for them on those hundreds of accounts over a 6-month span and see what the outcomes were, because what Maureen ultimately wanted to do was justify adding another one of those quality specialists to her team to drive up the impact. And so we did that over a 6-month span, again, late 2023 into 24. There were about 2,800 encounters audited within that. 9% of those resulted in DRG changes, and another about 12% had coding quality changes. And in total, what it showed was there was a million four in revenue capture in that time span, and then there was another like 673,000 in risk mitigation. Again, ultimately, really allowing Maureen to go to her quality or her personnel control and her CRO to say, hey, I've done this, project. I see that there's an ROI here, and I think it makes sense for us to actually add to our quality team because we're going to see the fruits from this labor, so to speak. And since then, they've actually really doubled their financial impact after adding that resource specifically.
Oh, and doubled the FTEs.
Yeah.
Inpatient side, when I started, we had 3. Now we have 6. And I have 3 on the outpatient side. So 9 coding quality reviewers and educators dedicated to this. And I think that's what's like really important as a takeaway. Being able to sell this to your administration, that it's the right thing to do. I always say, it's not all about the Benjamins. It's really about creating the quality program and the risk mitigation. In the beginning, it was a hard pill for me to swallow because I wanted to see the millions. But when we really look at the findings and, discharge dispositions, POA indicators, like look at the whole thing. And I'm so proud of the work that everybody does here. It's really amazing.
Yeah,
And so
Maureen, I do have a question for you. So I think that's a big thing, especially when you go to like a CFO who maybe doesn't have as much of that revenue cycle experience. When you talked about it not being all about the Benjamin. So was there any like sort of learn, or did you have to educate your CFO a little bit on, and what were those key things that you talked about other than the ROI and the financial impact? Because it was there, but sometimes even then it's a little bit of an uphill battle.
Oh, it was early on. It was, I think, 2022. I had to do a presentation at the CFO report out. And I called you and I was nervous saying, oh my goodness. And they wanted to know specifically about Streamline Health. And that's when I was concerned about what we were leaving on the table and being able to see the pyramid to say this many charts inflowed, but we only looked at 300 that month, but there were 900 that we didn't look at. And that's when, it started to tick with me that more people would allow for more review. So Brian, actually, when we were looking at that, it was glaring, the number. I couldn't hide it, right? It was just out on the board. And so we talked about it openly at the CFO report out. So I really didn't need to do much education there. And then with the support of Chris Alt and John Bucci, who I report to, we put together the plan to do the pilot. with Streamline to engage consultative services. So we had to spend a little money to make the case, but it was crystal clear as we were going through it. And then we did the engagement for 6 months.
And then, Maureen or Ashley, what kind of impact have all those adjustments made? You doubled the FTEs, you're seeing the impact come in. So what has that had on Cooper's accuracy, like the coding accuracy and compliance rates as well?
Yeah, I'm happy to say we are able to maintain our 95% accuracy for organizational wide for our coders. But then it also gives us a good metric to measure our vendors. So that's our high priority for our vendor coding. So we've been utilizing the data in, monitoring them, giving feedback, of course, educational as well.
And also from our clearinghouse, like pre-bill, we have metrics that are audited here. And we're averaging like 94% clean claim rate, which is amazing. And that's not the Epic number, that's from the clearinghouse. So we're really proud of that number. It was like 92, 93, and we've been steady now at 94. And I think that is really attributable to all of the work that we're doing pre-bill here at Cooper.
Yeah, and with the retrospective audits as well, with the pre-bill validation, how did you come to like the conclusion that these aren't really competing approaches? We see them as working together, so that, as you said, we can hit those numbers and kind of increase our FTEs and what we're looking at. How do you see them as working together versus competing?
Yeah, I mean, it's definitely working together. We're still leaving opportunities behind. Like like you guys mentioned, weren't auditing 100%. So going back retrospectively, that still gives us the opportunity to see what we have out there. And then of course, educational, we can't beat that. But yeah, we're still, they complement each other as far as we see.
So of course, when I got back to Jersey, right, I worked in New Jersey my whole career until I went to Florida for 13 years, and then I was back. So everybody was knocking on my door to come work at Cooper. So we have a third-party vendor that we use, post-bill DRG validation. And they went back a year. So we did this in, it was like 2022 we started it, and they found a lot of opportunities. So we took those opportunities and gave them back to Streamline and said, how come you didn't pick it up? So we were able to build, make sure that we were flagging some of those DRGs in a pre-bill situation. But now we still have the contract with this vendor, and they're finding very little. I mean, very little. It's a contingency-based contract. And yeah, it's really quite rewarding.
Yeah, and I think you had mentioned previously that you were auditing around 30, and now you've reduced that down to 20. Can you kind of talk about like what were some of those findings and those results and how you reduced that?
Sorry, can you
Can you
repeat the question?
No, so I was saying you had mentioned
Yeah.
Previously that refining your pre-bill validation process, you were talking about the volume have kind of dropped down. So can you just kind of expand on how you're using that strategically and kind of expanding on the relationship of all the coding vendors and what the results you're seeing are?
Yeah, definitely. So we're seeing like improvement in quality, not for our team, the educational. I mean, no trending is good because, they're not keeping repeating the same mistakes. So that's our big find as well. We kind of look at that, but also partnering with you guys and providing education to the coders. I mean, that's been the good feedback from the team as well. Pre-bill edits, we've been utilizing all of our data to create pre-bill edits in the system in Epic for our coder. So that's been a big new initiative we've been taking on for the last year. So we're trying to put it back on the coder in a sense. They're taking more responsibility in create it, because if you don't let them make their changes, they're going to keep repeating. So we're trying to put a pre-bill where they are having the edits, so they are knowing what their mistakes are, so it's not happening as much as should. And a big change was for discharge disposition. We saw about a 50% reduction in discharge disposition errors for the overall both coders and vendors.
And Ashley runs like dynamic reports from Streamline and turns that around to each. We use 3 outside vendors in our Camden location and gives them the DRG changes. So they want it more timely. One of the vendors was appalled by what we sent them, and they were very concerned with the findings. So we're trying to think of how we're going to do a pilot with one of our vendors that we send in a pre-bill state, the opportunities to them pre-bill, but we just don't want them negatively impacting our DNFB. So we have to have commitment from them that they're going to turn these around in 24 hours. Because any given day, we could be holding $8 to $10 million. We like to keep it at like 6 million within Streamline, but it's pre-bill. But still, if it goes to the 4th day, 5th day, it's hitting the DNFB. So you have to keep close eye on the work queues. And we learned that pretty early on.
And so you're using all of that to work together to, maximize your opportunities. And I know you mentioned earlier, Maureen, that you were jumping ahead. You were talking about, outpatient coding. So I want you to expand more on that. Like what, with all of what's happening with inpatient, kind of what led you to expand eValuator and the technology you were using beyond inpatient into the outpatient settings, and what was that experience like?
Yeah, it was, the outpatient team, they were starved for education and leadership and learning. And I was wondering, how come we didn't get the outpatient piece of this? And it just wasn't in the contract. So finally, we got the contract approved and we implemented the outpatient program of Streamline. And it was a slow start, I must say, because I think that the coders weren't really engaged in the beginning. They weren't paying attention. They weren't working the accounts. I wasn't seeing the return. I was like, how come all of these accounts are flagging, but there aren't any changes? So we had to do a re-education of the coders. Again, with Streamline, they conducted all the education for the team. And then right in the middle of this, there was a change in leadership on the outpatient side. So now Carrie Mathis is our outpatient coding manager. And so we have, at that point in time, we took an open position and made it into a coding quality specialist because we didn't have anybody really. We just thought, everybody could monitor their own, but it just, you need to have a well-designed plan. And so then we had one coding quality specialist. And then I hired a second. And just this week, we just hired a third for the outpatient. So we're growing that on the outpatient side. Not as ramped up as the inpatient, but we're getting there. And
then
actually, at that point in time, when I started, we had like 12 coders. Now we have 14 on the outpatient side.
And Maureen and Ashley Lodato, I know you presented at New Jersey HEMA last year on the outpatient program. So, Ashley Lodato, what was your biggest takeaway of, presenting with Maureen and Cooper University on that outpatient program?
Yeah, so Maureen touched on it a little bit. What stood out to me was it seemed like the previous leader had not been holding the coders accountable, which are some of the challenges that Maureen was sort of talking about when they first rolled out outpatient. It was pretty clear that they needed some direction. So as she said, she moved Carrie into that position. And what stood out to me was Carrie was sharing her story, and when she was sort of polling her team of coders, it seemed like there was a little bit of like coder dissatisfaction. There was room for improved morale. As Maureen kind of said, they were a little bit like starved of education, which was something that really stood out to me as Carrie sort of dug in and got to know her team and understand them and really understand them career wise, like as a coder, like what do you want to learn? Where do you want to go in your role? It was really interesting in how they leveraged our technology to do that. And that's like some of those soft benefits that we don't always recognize at times. A lot of times we're looking at like financial performance, quality, 95% accuracy, but there's all these like soft benefits that happen with this program where the coders were now able to hone their skills. It gave them confidence in their performance, which is obviously resulted in a much more positive team culture, as Maureen's alluded to. So that was something that really stood out to me as they sort of talked about their program and how they've been able to, you know, develop those coders now, and ultimately retention, right? Which is a big really big within our industry, right? Retaining coders, retaining good coders. And so this is a way to really help them develop their skills further than what's available out there.
Yes, and we also, during the past 2 years, recreated the job description. So we have coder twos and coder threes. And we're able to create training, internal training, and able to advance a coder two to coder three once they learn interventional radiology or cardiology or inpatient, advance them up. So, and our employee engagement scores are really good. So we were happy with our recent Prescaney scores for the department also. So and the employees, they look at, you know, they look at this as an opportunity for education. You know, and plus it's like I said, the pre-bill state, so it's great. They have the opportunity to review the recommendation, make the change, and move on. And we also, I forgot, we didn't even talk about, we have coder first here, so we have certain rules flagged where the coder goes into Streamline into their pool and works their own accounts, because we were trying to figure out more creative ways of we could get a higher number of charts reviewed on a monthly basis.
So with all that, improvement you're talking about, outpatient setting, inpatient setting, Ashley, Nanan earlier kind of went over a 50% reduction and, discharge disposition and those types of things. So, lots of improvement that we're hearing. What advice, Maureen, would you give to any other health system that's looking to refine their pre-bill validation?
Well, it doesn't happen by magic. I'm going to tell you, there's a lot, it's not easy. I mean, you just don't, get the software as a service and, plug it in and play. No, you need a dedicated team that's going to collaborate with the coders, and it has to be collaborative. Like I said in the beginning, it's not punitive. And like IT, you need your IT resources, be friends with them. Because it was so smooth, honestly, the implementation, because I was here for the outpatient, but having a good partnership with your IT liaisons is going to help the process also. And like selling it to the coders as a positive, that this is a great opportunity for the organization and for them. And then the coders could grow. We've promoted, what, 3 of the coders are now coding quality reviewers and educators. So we're promoting from within to that role also. So it's really, it's really a nice story that we're able to tell here.
And also ensuring as a leader, you are a super user. I think that's a good, learning from the beginning, being able to help the coders, you being a super user, learning the ins and out of the system. I think that helps a lot more and more involvement in the system.
and understanding, how many days you're going to hold the charts in Streamline. That was a big one for us in the beginning. I don't know what we had it maybe set to 7 days because we wanted to have the opportunity to work the outpatient accounts. And we were like, holy cow, we're holding 1,000 accounts. Change that to 0 days. And then everything went out the door. But so we learned pretty quick. But yeah, just, like a little thing like that, a little flag. Like we're like, what the hell's going on here? But yeah, so it was a learning experience, but a good one. And having, the collaboration among like with Ashley, teaching me the ropes and having the team of the coding quality reviewers, just being engaged. And being engaged with their coders.
And then to round this out, Ashley Lodato, I know you are going to ask about CAPE, I believe. So I wanted to round out the conversation here.
Well, yeah, I think Maureen, I would love for you to sort of touch on like how Streamline has and our client success team has played a role with you, and then obviously where you see our relationship moving forward with the addition of CAPE.
Right. So so Cape Regional Medical Center joined with Cooper last summer in July, and then in October, Cape came on our instance of Epic. So right now, they have 5 coders, and they're this one job description. So number one, I got approval, so we'll have 7 FTEs in coding. And also not any formal quality plan there or program. So the contract it's going through the ropes here. And hopefully within a couple of months, we'll bring CAPE on to our platform of Streamline Health pre-built technology. And the volume, it's a smaller facility. And so that's why we added this additional FTE just recently this week, with the hopes that we're going to share like outpatient and inpatient with the existing staff that we have here. We're not adding another FTE at CAPE. So we're looking at this an entire enterprise-wide quality program for Cooper Camden and CAPE. So yeah, I'm watching it go through the motions in our electronic contracting system. So hopefully, I would say, hopefully by June, we should be up and running, hopefully.
Excellent. All right. Well, thank you, Ashley, and Maureen. Really appreciate the conversation. We're going to dive into the Q&A portion, but before we do that, I've got another fun riddle for everyone. So I'm going to share my screen real quick. And this one, I'm not going to give you the answer till the very end. So this is a funny one. It is one day approved, the next day denied. My policies change. I hope you complied. Coder beware, for I make the rules. Who am I? So get your best guesses in, and I will give you that answer towards the very end of the webinar here. So now moving into the Q&A portion. Ashley Lodato, I don't know if you've had a chance to see the first couple questions. I have not yet, so
yeah,
I'm going to look.
Yeah, so while you're looking at some of those other questions, Charlie, Maureen, can you just confirm sort of there was lots of questions around your team structure and the numbers. So how many, inpatient coders do you have? How many outpatient? Probably comment on like what percentage of that is being either outsourced to a third party versus staffed coders. And then the same thing with your coding reviewers. How many resources do you have at this point? Am I putting you on the spot?
No. So we have 10 inpatient coders and 6 quality specialists, 14 outpatient coders, and we'll have 3 quality specialists. We do outsource, yes. Always on the weekends, we are outsourcing depending upon, who's on PTO or vacations and vacancies. But, so here, I mean, Ashley could speak better to this, but, they're only doing like, say, 1.7 charts an hour, because of the complexity of the cases here. So, probably be ready to maybe try to go back to the well, see if we can get additional FTEs on the inpatient side. But at least, the contract coders are being audited at the same rate that our own are. So, so I don't know, I guess, we're outsourcing to the tune of a full-time person, definitely on the weekends,
Mhm.
and then on the outpatient side, like ERs, where, we give a vendor, they have to do 100 to 150, just make sure that when we come in on Monday, I want Thursday done. That's the rule. We don't outsource more than we need to, just to keep us within the bill hold days.
I saw a question about our daily volume. So we're averaging about 100 discharges daily for Camden.
Next question is what is the retro audit percentage of accounts that a facility should be doing?
I think that number varies, but for us, we were trying to keep it at the 5%.
And still looking through questions here. While I'm looking through questions, Maureen or Ashley, what is your experience like with our client success team? We have, those folks on the call as well. So what's that relationship like when you make requests and they go over your data, and kind of just give us that experience while I'm looking at the questions here.
I love it. I wait for that email because we get it the day before. So I like to look at it and then either I'm happy or sad with the numbers. But we it's a very detailed reporting of what has happened over the last 12 months at a glance, month over month, see where we were, and then individually go over, the high opportunities, and then it compares us to where we stood against other streamline clients with DRG changes. And I'm really happy to say that we hardly ever have any trends with the DRG changes, which is good. And it's really eye-opening, when you look at it in the way that they present the data to you. And it's a great takeaway. And then we take that document and then we share it back to the coders. We don't have the coders on the call. That's too much time away from work, actually, but we do turn the information around to the coders and share with them the findings on a monthly basis. And then there's a help desk. If there's ever a request that we need, you open a ticket and, it's handled very quickly. No complaints with turnaround time anytime we open a request. And then on the calls, on the monthly call, on the fly, we'll decide, oh yeah, turn that flag off. Nothing's hitting. Let's turn
Yeah.
something else on.
That's the best part.
Yeah.
So it's not like I like that because, sometimes we get caught up in daily, but we can actually say, hey, let's turn that off right there and then. So you don't have to email it out or open a ticket. So you can just do it based on the trending. So I like that the most, I would say.
All
Yeah,
right.
Ashley, how do you leverage the findings from the client success reports and incorporate that into your education plans for the team?
Yeah, so my CQS and we meet weekly as well. So we kind of, talk about trending data. So based on the feedback, we will either say we're turning a rule off or we're turning it on, or if we want a new rule. So we kind of use that, but also, like I mentioned before, your team, they also provide education, which we use that to present back to our team. So that helps us a lot as well. So we don't have to start from scratch trying to create a presentation for the team. So that helps us too. So we leverage that and saving time.
All right. Any other questions from the audience before we wrap up here? I'm going to give you a few minutes. If there are any other questions, you can use the chat functionality or the Q&A functionality. And I believe we saw a few in the Q&A, but that was kind of wrapped into one question, right, Ashley Lodato? I just want to make sure we had that covered. Okay, perfect. Any other questions before I give the answer to our last riddle? I saw some really good guesses on the last riddle. I did see a question about kind of combining your pre-bill and retrospective audits into a QA score that our client success team was able to answer. So that, that is a possibility. If that's something you're looking at.
But
yeah, I was
not bad.
actually reading that comment. I actually like that suggestion.
Yeah, it's good. But, like we say, obviously,
Yeah.
we're looking for the opportunities. So, we want to be fair to the coder too, just not. So that's why it was important for Ashley to implement the retrospective auditing internally. So it's fair and equitable. And make sure we're picking charts that weren't selected in the technology.
Yeah,
Right,
I really like
because
what you
it's,
said.
yeah,
I really like what you said at the beginning too, Maureen, where it's, you don't look at this as punitive at all. It's all educational, and your team, the morale's being boosted, everybody's learning pre-bill, right? Where you're able to make those changes before it actually goes out the door. So I really like that mindset. Our client success chimed in on that as well, and that's the right mindset, and supporting and educating and being that for your folks. So I really enjoyed that.
So I also trend the pre-bill score for the coders as well. So if the coder is falling below 95% in the pre-bill score, we also do education. It's not punitive again, but we do education for those. But luckily, I haven't had any major trends for my internal coders in below 95 for the pre-bill. So we do trend that as well.
And that's why it was important when Ashley, collaborated with HR on the plan, that everybody's aware that there will be implications. If you don't cut it, you will be on a performance improvement plan. So luckily, we don't have anybody on one of those right now, but it is there and it's in writing.
All right. Well, if there's no other questions, I will end real quick by giving you the answer to the riddle. One day approved, the next day denied. My policies change. I hope you complied. Coder beware, for I make the rules. Who am I? Those that guessed insurance or insurance company correct, or payer is also an acceptable answer. So really appreciate you all participating in the funny riddles that we have. And really appreciate all the participation in this interactive webinar. So Maureen and Ashley, thank you again so much for joining this conversation. We really appreciate your time. Thank you all to everyone out there who joined the webinar. We really appreciate your time as well. And then thank you, Ashley Lodato, for joining me in this roundtable discussion. I hope everyone has a great afternoon.
Thanks.
Bye-bye.
bye, everyone.
Thank you all.